Dr. Ennis, since you're kind of an urgent care and an emergency care, or deal with workman's comp, car accidents, which is not workman's comp, but private personal injury. What about personal injury for, let's just say, young people on the soccer field or in playing tennis or the skateboard, and all of a sudden there was a wall or a railing and it kind of stopped them too abrupt. Do those people have a place in your place? There it is, the kid comes home screaming, crying, and swollen at the ankle, or God only knows where, at the head maybe. Is that a good place for mom to bring her kid?
Oh, most definitely. In fact, we do so much of that work, not only with adults and children, that we have 2 surgical suites that are set up for minor surgery. And so we do a lot of minor laceration repair. That's a part of our daily practice.
What are some of those minor surgeries? Because, anytime a guy comes with a knife close to me, it's major to me. So what do you call knife? What do you call minor?
Certainly what everybody's definition of the word emergency is different.
Right.
And we always let the patient define what is an emergency. Certainly what is an emergency for me is totally different than what is an emergency for you. And so we try not to argue with the patient. If he thinks it's an emergency, then we take care of him and use his frame of reference. But certainly in terms of lacerations, if a person has a life or limb-threatening problem, they should go right to the hospital emergency department. That's not something that we should take care of. But if a person is going to go to the hospital emergency department and wait 3 hours in the waiting room, we can see that case much quicker and get them in and out much quicker than they can in the hospital emergency department. So we do a lot of minor laceration. By minor lacerations, a laceration that's, less than 6 inches long and that has not had any significant blood loss. If when we see the case and evaluate the case and we determine that there are no internal injuries or foreign bodies or things that we cannot manage in our setting, then we refer the case to a general surgeon or to an orthopedist or even to a hand surgeon or a plastic surgeon. And so we have a full host of private physicians that we refer cases to if during our evaluation we determine that this particular case should not be managed by us.
Right. So a sprained ankle, a sprained or broken wrist, and usually it's difficult to determine without the X-ray and without the doctor's professional input of whether it is sprained or broken. Anyway, it hurts. And, people need to go somewhere. So that all belongs into your practice?
Oh, my goodness, yes. In fact, even today, I had a teacher that was walking across the parking lot and dragged her foot on a crevice in the sidewalk, and it caught on the heel of her shoe and caused her to fall. And she fell and landed on her left wrist and broke her left wrist. It's called a comminuted fracture, a multifaceted or multi-boned fracture of the wrist with angulation. And so that particular kind of fracture is not one that we can manage definitively in our facility. So I made contact with an orthopedist and had her transferred to the hospital, and she didn't have to see the emergency physician there. She was seen by the orthopedist, and the orthopedist did the reduction.
But when those cases come in which you eventually have to refer out because of the severity, the emergency really already get taken care in your place.
That's correct. That's exactly right. As an example, we don't really encourage people that have heart attacks to come to our facility. But sometimes it's easier for us to get a patient that has chest pain up to the coronary care unit in the local hospital than it is if the patient went to the hospital emergency department. And we call the cardiologist directly, talk to the cardiologist, and make all the arrangements so the patient gets to the hospital and gets the care they need quickly.
So basically, despite the fact that having a cardiac arrest isn't necessarily the thing you do, the patient coming to you it will still be in good hands, and you actually get him faster to where he needs to go than if he goes there directly. Is that what you're saying?
That has happened many times with us. That's correct.
Interesting. All right. Well, again, sports injuries, definitely a place to wind up in your place, and in most cases it's probably simple enough that that's all it is. It's usually probably, just current heavy pain, get it handled, get it rested, do what it needs to be done, and it's usually over with. And if it's a lot more, well, then still that first pain needs to be handled fast, not with 4 hours waiting in a hospital emergency room.
That's correct. And certainly if we think that the injury, a lot of athletic injuries need MRIs, and so it's easy for us to schedule an MRI with one of the private imaging centers, and so in a matter of minutes things are routed properly for a patient. We also see referrals from other physicians. Physician may be at lunch, or a physician may be on vacation, and he'll refer cases to us, and we obviously always refer those cases back to his office when we see them.
Sure. Well, thank you very much, doctor. Thank you very much.